I'll be taking the class on epidemiology and its methods. Okay, so what is epidemiology? Being a doctor, one day you will be specialized in cardiology, hematology, radiology, neurology. You have heard about these things, no? The doctor who practices epidemiology are called epidemiologists. Oh, sorry. They are called epidemiologists. Okay. In many of talk shows you have seen for a heart doctor when he says that, sir, what is the rate of heart attack? Who are the people affected? Why they are affected? Isn't it? The neurology, why strokes are happening. In other medical practice, when a doctor refers to a disease, he used to give some rate. Who are the people affected? Why they are affected, no? So they describe the thing, incidence, prevalences. So they are describing the epidemiology of that disease, isn't it? So in later on your life, when you become a doctor, a public health specialist, or a health administrator, even you go become a IAS or IPS officer, this is the most important subject in your exam will be coming. Even you attempt for UPSC after passing MBBS, this is the chapter in community medicine which covers maximum number of marks. So studying community medicine is very key to all the medical students, you know. And you have been knowing this, that all the subjects are taught for 1 year, isn't it? Community medicine is taught for how many years? 3 years. Wherever you join in government job, wherever you join in research, wherever you join in public health, wherever you go, the community medicine will never let you down. If you know it, you will be further away for another 10 people, isn't it? So learning community medicine is very, very essential. Further, when you join in medical services in government sector, you will be given the responsibility for implementation of government programs. Government programs. There are many government programs for tuberculosis. There is a TB program, malaria control program, leprosy control program, vector-borne disease control program, no? RCS program. One is immunization program, no? So you need to learn about everything, and this subject will tell you and taught you how to do these things. What are the components and how should we go about? Okay, so that is a different subject. I'll come now. This subject is also called disease detective or EIS, Epidemiological Intelligence Service. So this is one of the highest paid job in the world. Highest paid in United States after the surgeon. These epidemiologists are highest paid job. You recently heard about COVID, no? COVID. What was this? It was an epidemic or endemic or pandemic disease. Pandemic. So pandemic means it is from first is called epidemic, then endemic, then epidemic covers the whole of the region as a very greater area in the world. It is called pandemic. Now COVID has taught you what is epidemic and what is epidemiology. You know how many cases, everyday cases are rising, who are infected, whether children are more infected, what are the virus, mode of transmission, isn't it? Which is the country affected, no? So the person who describe those things are called epidemiologist. Okay, so in your textbook, I have taken this snapshot. I keep 6 honest servicemen. They taught me, I know their names and what, why, when, how, where, and who. You got, no? Whatever discussion we do, suppose there is a crime happen, the CID come. They are the investigator. They will try to investigate how this crime has happened, when, no, who has done it, no. The similar thing, if you remember those things, no, epidemiology is very easy. This chapter only investigative. You are a medical investigator. So Here, these only what, why, when, how, where, and who. So, this is your a part of competency-based medical education. So, this comes in competency in community vision 7.1. Okay, you know, now the government is looking for competency-based medical education. You know, he is a very competent surgeon. What does it mean? He is a very competent doctor. मतलब क्या हुआ? He is a very competent driver. मतलब क्या हुआ? He is the master. Okay, means she said he is the master means he has got the skill. He is the skilled, most skilled person. One thing. One of the words she said. Another one, competency. He is a competent doctor, competent engineer, competent driver. She said he should be a master. Very good. Means skilled. No? I had the skill to perform the operation. I never failed. Next, before this competency, I need what? Before the skill, I need what? We read books for what? Knowledge. Very good. Like this. We read books to get knowledge. When I have knowledge, I have tried to acquire the skill. Now, in community medicine, you are going to the family. No? Why? To get the skill. How to interact with the family, how to collect data. Because after passing out, nobody will tell you. Nobody will teach you. You have to do everything by yourself. Now, this is the time period. Now, you are learning this skill in the field visit also. Getting my point? So, first is knowledge. Then you get the skill. Then attitude. A right attitude is very important. I am a good doctor, but if I am arrogant, I talk very rough, will I be a very successful doctor? Nobody will come. छोड़ दो, बहुत डॉक्टर है देख लेंगे. People go to the lowest level of less educated doctor if he is a very good communicator. Isn't it? If I do not have a very good communication skill, I will have problem in every aspect of life. घर में भी झगड़ा, पत्नी के साथ, बेटा के साथ, मोहल्ले के साथ, everybody will have problem. सबके साथ झगड़ा होंगे, फ्रेंड में साथ. So having a good communication is very key for successful life. That is called social intelligence or EQ, emotional quotient. Nowadays, IQ is not important. You got the news. The Delhi University, the student, she got every time topper. She was the medalist. She got 40 medals. She applied for apprentices in many organizations and nobody called her. She wrote, came in the news. You got it. So why? Because knowledge is not important. Your skill is very important. Elon Musk, he said, you know what? Elon Musk said, I do not know in which university you studied, but I want what you know. If you know these things, I will hire you. If you do not, you may be passer from Harvard. ना हार्वर्ड से भी पास हो, अगर आपको कुछ नहीं आता, इलन मस्क नहीं ले रहा है किसी को. Isn't it? So, as a doctor, no, you have to be successful by yourself only. Nobody is going to help you. After passing out, no friend will be going with you. Everybody would be opponent. Though the भाई एक साथ मतलब दो doctors very very close friend, they are having sample another here. No, I am having very good patients and he does not have, because there are many factors. Like you need to have knowledge, skill, attitude, and plus another thing is that communication skill. So these are 4 things you write down. So these skills competition consists of like 4 things: knowledge, skill, attitude, and your communication skill. So here I will be discussing the definition of epidemiology and what are the principles of epidemiology and the concept and the uses of epidemiology. Okay, so And its competency is that you should know what is epidemiology. You should know how to do this measurement, how to do data collection, how to do the calculation of rates, and you have to able to show that how to do these calculations. So this is the introductory part of any subject. We should have a introduction. It is the basic science of community medicine, epidemiology. The community medicine previously known as social and preventive medicine. Before that it was known as preventive medicine, and before that it was known as public health. The public health is the beginning, Now the latest is community medicine and family medicine. We have a subject here, community medicine. You go to the aims, the subject comprises community medicine and family medicine. Okay. So because of that, that family component has been added. So this community medicine, epidemiology, this focuses on disease distribution, causation and health event in human population. Disease distribution, which diseases are distributed where? Causation, what is causing the disease? And health events. What is health event? We know disease, health event means accidents, suicide. These are also health events. Marriage, no? So health events. So where and which country we are having more number of accidents, in which seasons, at night or day. If you study these things, you are the epidemiologist. So then the origin of epidemiology is the ancient times, but in recent years it has been rapidly developed and it is more recognized now. So nowadays epidemiology is used for chronic diseases. Chronic diseases. What are the chronic diseases? I had common cold. It lasted for 2 days. It is acute disease. Chronic disease means I have backache for several years. It is chronic. I have cancer. I have blood pressure called hypertension. I have heart disease. So these are called chronic diseases. Now, these are called modern epidemiology. They are studying the risk factor of chronic diseases. So why? And that is help us to the risk factor. What is risk factor? Smoking causes lung cancer. So smoking is a risk factor, isn't it? Passive smoking causes lung cancer. It is also a risk factor. So epidemiology, they study the risk factors of diseases. So, and that helps to evaluate treatment modalities. Kya treatment honge? Improve health service effectiveness and planning, prevention and strategies. So now, what are the branches of epidemiology? Infectious disease epidemiology. I was a infectious disease epidemiology. I had to deal with polio. I was dealing with measles, mumps, rubella, those type of cases. Those are called infectious disease. Infectious disease, is cancer is an infectious disease? Cancer? No. Infectious disease from, if I have, like COVID was an infectious disease, isn't it? It transmitted from direct contact or blood-borne, through respiratory route, So infectious disease. Chronic disease epidemiology like cancer epidemiology, heart disease epidemiology, clinical epidemiology, serological cancer epidemiology, malaria and occupational epidemiology and so on. Many. जितने सब्जेक्ट हो उतने में epidemiology आ गया है अभी. So now this is the most important one and you will be asked in Viva. You will be asked in Viva, remember. So the root of epidemiology goes back to Adam and Eve. You know Adam and Eve? Adam and Eve, we are all the son and daughter of Adam and Eve. You know? Adam and Eve, who not heard about him? They are our forefather ancestor. They are the DNA. We belong to their DNA. Adam and Eve, you heard about? Adam and Eve, the first women and first men in this world. And they were trying to explore the forbidden fruit. They got a fruit, And the both of them together sitting and they were looking at the fruit, turning here and there, trying to smell, trying to get the taste. what they were doing? What they were doing? अगर आपको कुछ मिलता है, आप इधर उधर उसको देखते हो, what are you doing? You are investigating the thing. What it is? अरे ये क्या है? Means Adam and Eve also tried to explore the forbidden fruit. Means they are the first epidemiologist or they are the first investigator. You got a point? When you investigate something, when you want to know more something about a thing, you are a epidemiologist. Means you are an investigator, you are a CID, you are a CBI person. Now, in medical terms, we deal with the disease, no? That is why we call epidemiologist. So, it goes back to Adam and Eve when we were trying to investigate a forbidden fruit. Now, it has two components. You know, epidemiology, EP means among, demos means people, logos means study. You will be asked in Viva. This much you have to know. Viva is very important. Epidemics में क्या क्या word लगता है उसका meaning बताओ. ठीक है? So there is nothing to explore. That's what is happening. It is a study among people. It is a study among people, and it is called epidemiology. So there are milestones. You know how epidemiology has reached to the modern day. Now, first in 19th century, you come in 1850. Epidemiological Society was born in London, and it studied mainly on infectious disease. First, epidemiologist born to investigate infectious disease. Now, later on, due to the development of bacteriology, now this subject given little attention. Now again, coming to the 20th century, now you see Winslow and Sedgwick, they taught of epidemiology in US, 1920. Now we are teaching now, they taught in 1920. Again, 1927, W.H. Frost became the first US professor of epidemiology. Look. Then Major Greenwood, the first professor of epidemiology and medical statistics, University of London. Now the priority and importance is given to this subject. Now, in epidemiology, the epidemiology is well established medical discipline. There is no country where epidemiology is not taught. Even after passing your MBBS, you can go for MSc epidemiology in Harvard, Boston. You do not get this subject, epidemiology in India. If you want to go for specialization, then you have to go to US, you have to go to London. Very demanding subject and highly paid. But before that, no, you need to study epidemiology right now. You need to know everything about this subject. So, you make a search, epidemiologist. Now coming to the definition, it is for your exam purpose. There are several definitions. So I have picked up whatever here in your book. So 1873 is a Parkin. He said epidemiology, that branch of medical science which treats epidemic. The branch of medicine that deal with epidemic is called epidemiology. Means similar, no? Epidemiology. Frost in 1927, you know, it is chronologically increasing. The science of the mass phenomena of infectious diseases, similar like epidemic. The science of epidemiology is the science of mass phenomena of infectious diseases, like COVID-19 is a mass phenomena, not small. Then you come to Greenwood, 1934, the study of disease, any disease as a mass phenomenon. Motamoti same. McMahon, 1960, the study of distribution and determinant of disease frequency in man. But the most and modern accepted definition given by John M. Last in 1988. If you forgot these things also, but you must be able to write these definition. It is the study of the distribution, determinants of health-related state or event. These are two very important words, health-related state Health related states mean disease, mortality, morbidity, disability. These are called health related state. I am sick, I am disabled. Though these are health related state. And events, health related events like accident, suicide. No? So these are health related events. So this is the study of, there are three words you will be understanding now. Distribution and determinants of the health related state or events in a specific population. It has to be in a specific population, and the application of this study to control the health problems. Only investigation is not important. We have to apply the knowledge, like COVID. The investigator, the epidemiologist give the data, and he also said that it is transmitted like respiratory route coming into close contact. So similarly, the control, what are the controls were? यूज ऑफ हम लोग क्या यूज करते थे कोविड में? सैनिटाइजर, सोशल डिस्टेंसिंग, ना, यूज ऑफ मास्क so that people do not come. Why we did it? The epidemiologists say that if we go very close to a COVID infected person, I may get the disease because respiratory route. If I touch a person with my bare hand, I may contract the disease, and it is affected. It spread very fast in a very close space each other. It is called social distancing, isn't it? That is why lockdown were given. Who told PM to do the lockdown? It is a epidemiologist. So very important. You can control a disease, you can save a nation, the epidemiologist. So ultimately there are 5 definitions, but no definition is comprehensive. No definition has the all component, but these 3 components are common to all. You must be able to write. Like you remember COVID. COVID में क्या हुआ? Disease frequency. Frequency means how much people are affected. This is the frequency of any disease. How much? How many? Disease distribution. Which area is affected? India, Bangladesh. Within India, which states are heavily affected? Within the states, which cities are heavily affected? No? This is called distribution, and it helps to control the program. Isn't it? If cyclone is coming to Orissa, I will be sending my NDRF to Orissa only, not to Tamil Nadu. Isn't it? Where there is a problem. So, epidemiology used to say that where is the disease happening, and disease determinants. Determinants means what should be the determinants of a good student? A student who always practice, who always study, always attend classes. These are determinants. So, the determinants of a disease means the factors which help to acquire or transmit the disease. Isn't it? So, these are in this epidemiology definition, these 3 things is very important. Disease frequency, disease distribution, disease determinants. Okay. So, your book has everything in it, but I have particularly summarized here. Okay. So, any problem, any issue? हम भी पास हुए, लेकिन ना मेरे टाइम में ऐसे नहीं सिखाया था. Now you can see and you can hear. Now in our time we can only hear, nothing we can see, or we did not get mass elaboration. Okay. But here time, that is called competency based. Initially it was a rote learning. Rote means आप सिर्फ मुखस्त करो, है ना, और बाद में आप जाके निकाल दो. अभी ऐसा नहीं है. Now you have to learn, you have to know, and you have to do. So coming to disease frequency, जो अभी explain भी करना है. What is disease frequency? ना, disease distribution and disease determinants. Come, disease frequency. So we measure the frequency of disease, disability and death. इंडिया में कितना मर रहा है, कितना डिसेबल हो रहा है, कितना डिजीज कहाँ हो रहा है, ना, So it measures the frequency of disease, disability and death. Now these are expressed in terms of prevalence rate, incidence rate and death rate. These are very important indicator in epidemiology. So prevalence rate, incidence rate. What is the incidence of tuberculosis in India? Incidence of HIV. अगर आपको कोई पूछे, you need to know ये आदमी हमको क्या पूछ रहा है. Incidence means new case. कितना हो रहा है, ना? Prevalence means old and new cases together. So death rate. And why these rates are important? Why? So they help us to compare a disease frequency. बांग्लादेश में डेथ रेट है 9.8, इंडिया में डेथ रेट है 6.8. Which state country has a higher death rate? Huh? Bangladesh. So without knowing the rate, can you say? That is why run rate, कोहली का रन रेट इतना है और सहक का रन रेट कितना है, बोलते हैं ना, those who are cricket lover, for dear, this is rate. Why rate is important? Rate help us to compare, है ना, compare करना अच्छा है. So if we know the rate, it also gives us the causal factors, what causing the disease. ये इतना ज़्यादा क्यों हो रहा है, ज़्यादा हो रहा है तो क्यों हो रहा है, it gives us the causative factor. एंड अगर ज़्यादा हो रहा है ना, उसके लिए गवर्नमेंट क्या करेगा, दे ब्रिंग आउट कंट्रोल प्रोग्राम्स. बहुत ज़्यादा कोविड का स्प्रेड बहुत ज़्यादा हो रहा है, गवर्नमेंट क्या करेगा, अगर आप देते हो सर काल तो 5% था अभी 15% हो गया सर, गवर्नमेंट क्या करेगा, इमीडिएटली दे ब्रॉट सम कंट्रोल मेजर्स. नहीं इसको रोकना है, रोकना मीन्स कंट्रोल करना, ठीक है. सो दीज आर, इफ यू थिंक लाइक no need to even study, but you have to remember the terminology. Incidence क्या होता है, prevalence क्या होता है, what is the rate, no? So for calculation of these things we know the statistics. Now in class 12, no, and class 10 also you know very good maths, rate, ratio, proportion, no? So those who are a very good maths lover, there is a good news for in this community medicine, that there are some maths also, statistics also, computer also. You need to learn computer also, how to use computer in community medicine. आपने ढेर सारा डाटा लेके आया, एक्सेल में भराया, now you need to do for mean, mode, average, no, frequency distribution. तो कंप्यूटर भी आएगा. You need to have a competency. एग्जाम में वो भी देखा जाएगा, whether you know computer. So disease frequency आ गया. Now disease distribution. Distribution में क्या आता है? You know, the health and disease is not uniformly distributed in human population. Disease is not uniformly distributed in human population. इंडिया में जो disease है वो US में नहीं है. इंडिया में अगर 15% है, US में 1% है. Isn't it? So diseases are not uniformly distributed. जैसे मलेरिया, त्रिपुरा में क्या डिजीज मलेरिया है, एंडेमिक है. मलेरिया इज ए एंडेमिक डिजीज इन त्रिपुरा, एंडेमिक. इट हैपेंस थ्रू आउट द ईयर, इट इज ए लोकल डिजीज हियर, एंडेमिक डिजीज बोलते हैं त्रिपुरा में. दिस मलेरिया इज नॉट देयर इन अमेरिका, isn't it? So this is the most important sentence. Diseases are not uniformly distributed in human population. Now what epidemiologists they do the study of the pattern of distribution in the community. What is a pattern? Time. ये बीमार सर्दी में ज़्यादा होता है ना गर्मी में ज़्यादा होता है, इनकी जो डिक्रीज ओवर ईयर्स. सम डिजीजेस ना पैटर्न, कोविड पहले इतना था, अभी कोविड है ही नहीं. इज नॉट इट? नेक्स्ट प्लेस, द डिस्ट्रीब्यूशन इज हायर इन वन प्लेस एंड लेसर इन अनदर प्लेस. एंड पर्सन हु इज गेटिंग मोर द डिजीज, लाइक मेन, फीमेल, चिल्ड्रेन, who are getting the more and more diseases. So that this is the distribution of disease means why this area is more affected, why these persons are having more diseases. So this is called distribution. This may be geographical distribution also. So the branch of epidemiology that study the distribution of disease is called descriptive epidemiology. Descriptive of epidemiology means they describe the disease or health event. So descriptive epidemiology, what, where and who is affected. Okay, so these are very, very important and it helps the government to develop control and prevention strategies. Okay. Those who do not look in the slide, they will have very problem later on. Because you will study but you will not remember. If you can remember this word, that you will get some taste that, yes, this subject was taught. This terminology was taught. Okay. So, now coming to the third component of epidemiology is called determinants of disease. Determinants of disease means what are the factors responsible for causing the disease. Okay, factor responsible for causing the disease. So this is the core function of epidemiology, and this gives the etiological hypothesis. Etiological hypothesis means if I am having a disease, if some population is having a disease, if you study that, it may give you some clue that what is the cause of the disease. So these determinants of disease, they identify the risk factor of the disease. Risk factor of the disease. So this is the branch of epidemiology that deal with the risk factor is called analytical epidemiology. So we have got two terms, what is called descriptive epidemiology. Descriptive epidemiology, they deal with the description of a disease in terms of their distribution, descriptive epidemiology. And if you find out the determinants of disease applying the epidemiology, it is called analytical epidemiology. So again, if you know the etiology means, what is the etiology of a disease means? Etiology of disease means, अरे भाई डॉक्टर बनने जा रहे हो, etiology, causes. Etiology means causes of disease. So if you know the cause, can you control it? ना? किसी को डायरिया हो रहा है, हैविंग डायरिया, क्यों हो रहा है? बोले ई कोलाई हो रहा है ना, साल्मोना से हो रहा है. अगर आपको पता है, यू कैन कंट्रोल इट. अगर किसी गांव में जा रहे हो जो डायरिया हो रहा है, क्यों? बोले पानी, खराब पानी की वजह से हो रहा है, पानी उबल के खाओ भाई, कंट्रोल हो गया ना. सो इफ यू नो द इटियोलॉजी देन यू कैन कंट्रोल द डिजीज. हमको मालूम था जो कोविड का इटियोलॉजी क्या है एंड द फैक्टर्स, इसीलिए वी कंट्रोल द कोविड. अगर हमको पता ही नहीं चलता तो हम कोविड को कभी नहीं ख़त्म किया. ठीक है. सो कम टू द एम्स ऑफ एपिडेमियोलॉजी. एपिडेमियोलॉजी का एम क्या है? ठीक है. सो दिस इज the aim is given by a society. This is International Epidemiological Association. There is the association. If you are an orthopedic doctor, there will be orthopedic association. If you are a cardiology, you are a cardiologic association. If you are a diabetologist, there will be a diabetologic association. Everyone there has own association. Similarly, epidemiological association is there in international. Okay. So there is Indian Epidemiological Association, International American Epidemiological Association. So there are three aims in epidemiology. These are the long questions comes in exam. To describe the health and distribution and magnitude of health and disease. Sir. Okay, sir. To identify the risk factors of a disease and to provide essential data for planning and implementation of health programs. So these are the aims. Why do we do the epidemiological investigation? अगर कहीं पे क्राइम हो गया, why CID is doing this investigation? उसका एम क्या होता है? खोज के निकालना ना क्रिमिनल को. CID इन्वेस्टिगेशन सिमिलरली epidemiological investigation का मतलब यही होता है. Similarly, so that now you can find out the risk of factor, cause of the disease, and how and why the people are affected. So that now you can plan a control strategy. So these are the main approaches: descriptive, analytic, and experimental epidemiology. So they will be taught in detail in subsequent chapter, but now you need to remember descriptive epidemiology, analytical epidemiology, and experimental epidemiology. Now there is one difference. This is very important, you should learn. One is called clinical medicine, means doctor, a cardiologist, a medicine specialist, or a surgeon. No? And another person is an epidemiologist. He is also a doctor, but their job is totally different. Na? हमारे उधर OPD ना, there is a OPD. What services is given there? OPD में they treat the disease people. The clinical people, the clinical doctor, they treat the case or individual person. जिसको मरीज को देखता है clinical doctor. Epidemiologists ना, they work for the population at risk. Epidemiologist मरीज नहीं देखता. Okay, they work with a population or a population at risk, जिसको बीमार हो सकता है. Now, the clinical medicine, they primarily focus on individual patient. Here, the disease of the entire population के ऊपर focus करता है. You see, epidemiologist is not concerned about a single person. Clinical doctor no, they आपको क्या हुआ? सर्दी जुकाम बोले ठीक है, आप देखते हैं. Epidemiologists, they do not see the single patient. Like COVID में देखो, one was epidemiologist. He was focusing on how many cases happening, who are getting affected, what is the death rate, how it is getting transmitted, and he brought about the idea of using mask, using hand sanitizer, giving social distancing, and you go to the clinician, they are managing the patient. एक patient आया बोले आप आओ, isn't it? So epidemiologists, they do not treat the patient, but they take care of the entire population. Now, clinical medicine, the doctor, they seek to diagnose and prescribe treatment for the individual case. जो clinical doctor होता है ना, आप जाओगे ना, आप ये टेस्ट करो for diagnosis. कब diagnosis आएगा ना, आपको treatment करेगा जो clinical doctor. लेकिन जो epidemiologist है ना, ये इनका जॉब है. तो epidemiologist ना, आप sick को भी देखता है और healthy को भी देखता है. Now they trying to find out the spread of the source of infection, mode of spread, etiology क्या होता है, and what are the factors responsible for the spread of the disease. Now their role. So the investigator role in clinical medicine, the physician derive a prognosis and prescribe treatment, goes out to find person with disease and suspected causal factors. Clinical में ना एक ही होते हैं ना, they try to cure the person. लेकिन epidemiology, they analyze the data collected from the population so that a control program or other interventions can be planned. Now, clinical doctor क्या करते हैं? They used to this clinical and laboratory examination, post-mortem report, clinical doctor, to find out the cause. लेकिन epidemiology, they analyze using statistical tool, yeah, and to find out what is the rate, what is the relationship. So these are the differences, and this is asked in the exam also. Okay, how a job of a clinician is different from a epidemiologist. Okay, so but now first of all you need to be a doctor first, then you can be a clinician and a epidemiologist. Okay, before being an epidemiologist, the knowledge of doctor and medicine is very important. Without that you cannot be. Okay, now I will come to this topic later on, but no, I must say you should know what is epidemiology. The three words, epi, demos and logos. Definition of epidemiology, there are four definitions. These are the previous definition, earlier definition, recent definition given by John M. Last, his definition. The epidemiology, three things are very, very important. Disease frequency, disease distribution, disease determinants. These are very critical component of epidemiology. And you need to describe disease frequency. Disease frequency is described in terms of prevalence rate, incidence rate, death rates. Okay, so prevalence of disease, kitna hai, kya hai. Incidence means how many new cases are happening. Death rate matlab kitna mrityu hua hai. So this is disease frequency, disease distribution, where these people are affected, no? Whether ladies, male are more affected or female are affected, whether children are affected, whether elderly are affected, whether a particular the area is affected, whether the distribution more in winter or summer, no? Like heat wave. Heat wave ka distribution kya hai? Whether it is more in summer or winter. Heat wave? Summer. So if you say like this, you are an epidemiologist. Okay. So determinants of disease. Three things kam se kam yaad rakhna. Distribution, frequency, distribution and determinants. Epidemiology. ठीक है? So I'll see you in the next class. Thank you so much for your attention.